be presenting a narrative review manuscript on the topic the experiences of oral cancer patients. The experiences of oral cancer patients, and you can see the authors were cited. This is a narrative review, and it's talking about the experiences oral patients has. This study was carried out to get the experiences of oral cancer patients, what their experiences with this illness looks like, what is it like. So it's a qualitative method of research. So here's the abstract. This is a critical review of current evidence on patients' experience with oral cancer, the impact on the quality of life, and implication of clinical practice and research were also discussed. This is the abstract. A comprehensive search of 3 databases, PubMed, Scopus, and Google Scholars, were undertaken. The search was restricted to English language primary research papers from 2009 till 2019. The following keywords were used, as you can see: mount neoplasm, patients, experiences, oral cancer, physical, social, psychological. A total of 173 studies were retrieved using the search strategy. After removing duplicate reports and scrutinizing those based on title and abstract, 68 studies were shortlisted for full text review. 3 major themes emerged from the literature. 1. Physical experience of oral cancer patients, psychological experience of oral cancer patients, social experience of oral cancer patients. Experiences of oral cancer patients are complex and subjective, and phases of physical, psychological, and social experiences of oral cancer have been explored in details. So they've told us in details what these experiences look like. However, there is evidence that experience such as pain, partial alteration, body image disturbances, anxiety, depression, social avoidance, social support, and financial implications affect patients' quality of life. This review underlines the importance of further research to look into the type of support needed to address these various experiences of oral cancer patients. This study was carried out to see the support they can give, the care they can give to address these experiences oral cancer patients has. So this, let me just explain the abstract so you guys can understand. This research, the researchers actually looked thoroughly for studies using 3 major online research, as you can see there: the PubMed, Scopus, and Google Scholar. The research was restricted to English language primary research papers. That they only look for original studies written in English that were published between the years 2009 and 2019. And they found 173 studies at first, after removing repeated ones and checking which one seems relevant. Okay, by reading this title and summaries, they picked 68 studies to read in full and consider more closely, which we are going to see. So we go to the introduction. What oral cancer is. Alright, oral cancer refers to a malignant neoplasm of the lip, oral cavity, salivary gland, and oropharynx, which correspond to the code COOC10 of 10th revision of the International Statistical Classification of Disease and Related Health Problem. It's saying that oral cancer is a serious disease that affects the lip, the mouth, tongue, throat, and salivary gland, and is among the top 10 most common cancers in the world. In 2018, as it was recorded there, over 250,000 people died from it globally. I wouldn't want to waste much of time on the literature. The narrative literature review compiles available evidence of oral cancer. This narrative review actually It's gathered the evidence of oral cancer experience across the disease trajectory. This will help healthcare professionals, as I said earlier, and policymakers to better understand the experiences of oral cancer patients and facilitate the development of comprehensive patient-centered care and support for the patient. So the method, 3 electronic database were searched using 7 major keywords: mouth neoplasm, patient experiences, oral cancer, physical, social, and psychological in combination. These were the experiences they got. The following restrictions were applied to the search: papers published in English language from 2009 to 2019. So I'm explaining the method now, as I said earlier in the abstract. Primary research experiences. The online search was also supplemented by manual search and examination of the reference listed in the identified research papers. All primary studies reported experiences of being diagnosed and treated for oral cancer published in English from 2009 to 2019 were identified. Titles and abstracts of these studies were screened. Duplicated studies and studies that were not related to oral cancer were removed. So we're talking about oral cancer. So the studies that were not related to it were removed. Any disagreement was resolved by discussion to achieve a consensus among all authors. Studies fulfilling the aim of these reviews were included for full review and exported to the reference managing software. So the results, the search strategy and initial screening of abstract titles yielded 173 studies. 173 studies. After removing duplicates, 170 studies were scrutinized according to the predetermined criteria, and 108 were shortlisted for full text review. Following discussions and review, 68 studies were included in the final list. The studies included in this review reported, these were the results from the research that was carried out. The studies included in this review reported experiences of oral cancer patients from different cultural backgrounds living in 23 countries around the world, except for Antarctica and Africa. The remaining world continents were all represented with studies from Asia, in China, India, Japan, Pakistan, Taiwan, then North America, in Canada, and United States of America, then in South America, in Brazil, in Europe, in Bosnia, Denmark, France, Germany, Iran, Italy, Netherlands, Norway, Portugal, Sweden, Switzerland, and United Kingdom, and in Australia and Oceania, in Australia. So this researcher, let me explain this particular method now. These researchers looked at and included stories, like the experiences. They included stories and experiences shared by oral cancer patients who come from different cultures and live in 23 countries across the world, but not in Antarctica or Africa. So it shows that these studies has global reach, but misses the African perspective entirely. And this can be seen as a limitation because the experiences of oral cancer patients in Africa might be very different due to factors like maybe healthcare access, cultural belief, and stigma. So they didn't search in Africa and Antarctica. They didn't get the experiences from oral cancer patients from those countries, except from this one that were listed. So 3 major themes emerged from the literature, which are the physical experience of oral cancer patients, the psychological experience of oral cancer patients, and the social experience of oral cancer patients. So the findings of this review were presented in the light of these interrelated experiences, which they explained in detail below. So I'll be breaking down the explanation of the different experiences. We have the physical experience of the oral cancer patient. What is their physical experience like? Pain. Physical experience, pain. Most patients feel strong pain, especially when speaking or eating or chewing. And also their physical experience also is dry mouth. It's also known as xerostomia. Then this treatment reduced saliva, making it hard to eat and talk. We also have another physical experience that was listed here is mouth problem, which includes infections, bleeding gums, inability to open the mouth, which is called tremors. So they have the name for these physical experiences. We also have facial disfigurement. Surgery and radiation can change a person's face, affecting how they speak, eat, or look. And these issues lower the quality of life and make people feel uncomfortable in public. So these were the physical experience they gathered from oral cancer patients. And now they went over to the psychological experience. As it was listed from the literature, there were 3 experiences that were gathered: the physical, psychological, and the social experience. Now they went over to going over to the psychological experience. Mental health, it's among the psychological experience that was discovered here. Patients often feel anxious, depressed, or helpless, especially before and after the treatment. Yes, oral cancer patients can be affected psychologically. Their mental health can be affected. They can feel depressed, they can feel helpless, they can feel anxious. And also body image issues is part of the psychological experience oral cancer patients can feel. Changes in their appearance can make a patient feel unattractive or trapped in a strange body. Being a dental technologist, as my profession, I've actually seen the result of this disease on patients working in the hospital or lab, because this social, this psychological, this physical experience are real. Yes, they suffer it, they feel it. It affects their mental health, it affects their physical health, it affects their social experiences, it affects them. Imagine having oral cancer and maybe a part of your mouth is disfigured. It will affect your body image. You won't be able to come out, and it's a psychological experience. It affects them psychological. It doesn't affect them emotional. They also gather that part of the psychological experience is also emotional stress. Fear of the cancer coming back is common. Then we also have the part of the psychological experience, also treatment type matters. Like those who only had surgery often feel better than those who had both surgery and chemotherapy radiation. So all these psychological experience were gathered from oral cancer patients. So we go over to the social experience of oral cancer patients. Wow. Social avoidance. Patients may withdraw from family and friends because of embarrassment and shame. Yes, social experiences are also real, affecting oral cancer patients. Financial stress too. Treatment can be expensive. Going to the hospital bills are expensive. Not talk of treatment, not talk of this particular oral cancer treatment. Treatment can be expensive and it can affect them socially, because many patients cannot return to work. Also, relationship strains too. Difficult with intimacy, speaking, and eating affects their interaction. When a patient has oral cancer, it affects them socially because it affects their speaking, it affects their eating, it affects their interaction. You'll not be able to communicate or interact very well, and that is a social experience from oral cancer patient that was gathered. And also support system. Those with strong family support cope better, but those that their families, they don't get full support from their family. So it's a social experience from them, because they tend to struggle. If they don't get enough support, they don't get better support system from their family, they tend to struggle with this experience. So these were the experiences that were gathered from oral cancer patients in the countries that the research were done. So the discussion, the diagnosis of oral cancer have a significant impact, not just on the patients, but on their spouse, partner, family, and broader social network. Patients with oral cancer experience tremendous physical, psychosocial, and social challenges. The experiences are unique to the individual, as each patient will respond differently to the disease and its treatment. Why disease interpretation, outcome, and experiences of patients may vary. Yeah, the close interrelatedness among physical and functionality, psychological suffering, and social distress of oral cancer is unquestionable. And pain is a very significant factor influencing the daily living activities of oral cancer patients. Pain can never be removed from this experience, and pain can come in form of physical, pain can come in form of emotional, social, and psychological, as listed there. So pain, mental stress, and I'm summarizing the discussion now. Pain, mental stress, and social struggles are all connected. That was what was found too. Losing the ability to do simple things like eating or talking can deeply affect a person's emotion. Support from doctors, nurses, and families is critical to help patients adjust and stay hopeful. And some patients do find strength through religion, family, and inner resilience. So this narrative review identified physical, psychological, and social experiences of oral cancer patients. The review includes results from both quantitative and qualitative studies on heterogeneous samples of oral cancer patients from various cultural backgrounds, using various quality of life instruments. They're explaining now how these studies were both quantitative and qualitative. So on heterogeneous samples of oral cancer patients from various cultural backgrounds, using various quality of life instruments and interview topics guide respectively. However, the experiences presented in this review were derived, hence may not be the comprehensive narration of oral cancer patients. Furthermore, none of the included studies reported physical, psychological, and social experience of the oral cancer patient all at once. So additionally, oral cancer is a broad term referring to malignant neoplasm of the lip, the oral cavity, the salivary gland, the oropharynx. Indistinctness exists in the literature associated with the terms used to describe the disease, as some studies use the term head and neck cancer to refer to malignant neoplasm of the oral and oropharynx area. Nevertheless, we have made the attempt to reduce this ambiguity by including studies that met the criteria for inclusion and studies on neck, head cancer beside oral cancer. So in conclusion, the experiences expressed by oral cancer patients are of varying nature with high subjectivity. Reflecting of the complexity of disease progression, this review delivers an overview of the physical, psychological, and social experiences of oral cancer patients across the disease strategy that vary according to the affected site, stage of disease, type of therapy, and other personal and environmental factors. The physical, psychological, and social stressors are often intertwined, both resulting from and contributing to each other. This review highlights the need for further qualitative research on the broad experience of oral cancer patients that can help inform a better understanding of this issue. A comprehensive list of experiences and a good understanding of patients' experiences would provide a sound basis for development of patient-centered and individualized care. Considering that oral cancer experiences are unique to each patient, this information will enable healthcare providers to focus on individual patients' support requirements and needs depending on the patient's significant issues or challenges in life. So every patient experiences with oral cancer. I'm trying to summarize now the conclusion. Every patient's experience with oral cancer is different, as said in the research, in the manuscript. We need to treat not just the disease, but also we need to care for our mind and our social needs. psychological, social experiences, as we saw there. More research is needed. So this research is not even okay. They need more research to really get this experience from oral cancer patients. So more research is needed to truly understand what support patients want, what they really want. These people that are suffering from oral cancer, what do they really want? What do they really want? How can we provide this support and care to help them to tackle their experiences? So this more research is needed to truly understand what support patients want and how to help them live a better life. So I think I'm done. Further, we have the references. Okay, this manuscript, this oral cancer, the experiences of oral cancer patients, the manuscript was published in the Journal of Public Health Medicine in 2021. Malaysian Journal of Public Health Medicine in 2021, and it was a Vancouver citation. So the Vancouver citation, excuse me. So I think with that, I'm done with my presentation. Please, is there any question or contribution to the manuscript presentation?
Yeah, I think, Favor, that was a very, very great presentation. It was very inciting hearing from you, and I really love the way you really detail and not just detailing it, it's also providing other insights for us to know about the concept. Aside from you talking about the methodology, you still hit the head on the hammer.
Thank you so much, sir.